Stop. Before you skip this video, answer me honestly. Do you feel a burning, shooting pain that starts in your lower back and travels down one leg? Does it get worse when you sit for more than 20 minutes? Do you wake up stiff and in pain every single morning? If you said yes to even one of those, this video was made for you. Because what I'm about to show you is something most doctors never tell their patients. Stay until the end. Your sciatic nerve will thank you. Welcome. In today's video, we're going deep into one of the most common and most misunderstood sources of pain in the human body, the sciatic nerve. Here's what nobody tells you. The sciatic nerve is the longest nerve in your entire body. It runs from your lower spine, through your hips, all the way down to your feet. When it gets compressed or irritated, the pain can be unbearable. And here's the frustrating part. Most people try painkillers. They try rest. They try expensive physiotherapy, and the pain keeps coming back. Why? Because they're treating the symptoms, not the cause. I've seen this pattern thousands of times. People suffering for months, even years, when the real solution takes less than 3 minutes a day. Today, I'm giving you that solution. 5 targeted moves, 1 powerful bonus tip, and a result you'll feel within 72 hours if you actually do this consistently. Let's go. First, let's understand what's actually happening in your body. The sciatic nerve exits your spine at the L4, L5, and S1 vertebrae. It then passes through a small muscle called the piriformis, and this is where most people go wrong. When you sit for long hours, your piriformis muscle tightens around the sciatic nerve like a clamp. Your hip flexors shorten. Your lumbar spine loses its natural curve. And together, these 3 things create a perfect trap for your sciatic nerve. Now here's the important part. 85% of sciatica cases are not caused by a disc problem. They're caused by muscle compression. Which means you can fix this yourself. Without surgery, without injections, you just need to release the right muscles in the right order. There's also a second hidden, because most people completely miss, tight hamstrings. When your hamstrings are chronically tight, they pull on the base of your spine, increasing nerve tension all the way down the leg. We're going to address all of this today, together. Let me show you the exact sequence. Before we get into the moves, if you haven't subscribed yet, please do it right now. Hit that subscribe button and the bell icon. Every single day, I share simple, science-based techniques to help you feel better naturally. No complicated equipment, no expensive programs. Just practical knowledge your body actually needs. Subscribe now. I'll wait. Okay. Let's get into the 5 moves that will change your mornings forever. Morning Nerve Reset, Move 1. Move number 1. The Morning Sciatic Reset. Do this before you even get out of bed. It only takes 60 seconds and it rehydrates the disc space in your lower spine. Lie flat on your back. Bring both knees up to your chest. Now gently rock side to side slowly for 30 seconds. Feel the gentle traction on your lower spine. Then bring your right knee toward your left shoulder. Hold 15 seconds. Switch sides. This decompresses the nerve root before gravity loads your spine. Why this works? While you sleep, your discs absorb fluid. This move distributes that fluid evenly and prevents the morning compression spike that most sciatica sufferers experience the moment they stand up. Move number 2. The piriformis release. This is the most important move in this entire video, because the piriformis is almost always the hidden culprit behind true sciatic pain. Sit on the edge of a chair. Place your right ankle over your left knee, making a figure 4 shape with your legs. Sit tall, then slowly lean forward with a straight back until you feel a deep stretch in your right glute. Hold this for 45 seconds. Breathe deeply. You should feel the stretch deep inside the hip, not in your knee or your back. Repeat on the left side. Do this 3 times per day. Morning, afternoon, evening. Most people who've done this consistently for 3 days report a significant reduction in that radiating leg pain. The piriformis has to let go for the nerve to breathe. This move does exactly that. Move number 3, the hip flexor unlock. Remember I told you tight hip flexors tilt your pelvis forward and increase nerve tension? This move reverses that. Step your right foot forward into a kneeling lunge position. Lower your left knee to the floor. Now gently push your hips forward while keeping your spine tall, not leaning back. Feel a deep pull at the front of your left hip. Hold 40 seconds. Switch sides. Here's the key. Most people miss. While you're in this position, gently tuck your tailbone under this posteriorly, tilts your pelvis, and creates direct traction on the sciatic nerve pathway. It's a small movement, but it makes this stretch 3 times more effective. Move number 4. Spinal decompression. Hang. Gravity compresses your spine all day long. This move fights back. Stand in a doorway. Place both hands on the doorframe at shoulder height. Let your knees bend slightly so your body hangs with your arms, taking some of your weight. Relax your lower back completely. Hold for 30 seconds. If you have a pull-up bar, you can do a full dead hang even better. What's happening here? You're creating negative pressure in the disc space, literally pulling fluid back into the discs, increasing the space between vertebrae and reducing the compression on the nerve root. Research shows even a 30-second hang can increase disc height measurably. Do 3 sets of 30 seconds. Rest 20 seconds between sets. You'll feel your lower back lengthen immediately. Most people feel relief within the first set. Move number 5, and this is the most powerful one, the sciatic nerve glide. Most people have never heard of this technique. It literally flossing your sciatic nerve through the surrounding tissue, breaking up adhesions and restoring normal nerve mobility. Sit upright in a chair. Straighten your right leg out in front of you, toes pointing up toward the ceiling. Now slowly flex your foot so toes point toward you. Hold 2 seconds, then point them away. Hold 2 seconds. At the same time, gently tilt your chin to your chest as you flex the foot and lift your chin as you point the foot. This creates a pumping, gliding motion through the entire sciatic nerve from your neck to your toes. Do 15 repetitions per leg, twice a day. This technique is used by neurologists and physical therapists for post-surgical nerve recovery, and it works just as powerfully for compression-based sciatica. You may feel a mild stretching sensation along the back of your leg. That is completely normal. That is your nerve waking up. Now, just as important as what to do is what to stop doing immediately. Number 1. Stop sitting on your wallet. I know it sounds strange, but sitting on a thick wallet tilts your pelvis and pinches the piriformis for hours a day. Number 2. Stop sleeping on your stomach. This position hyperextends your lumbar spine all night and worsens discompression. Number 3. Stop doing straight leg toe touches when you're in pain. This overstretches an already irritated nerve and often makes sciatica significantly worse. These 3 habits alone, if you're doing them, can completely cancel out everything you just learned. Fix these first. The results will multiply. Here is your bonus tip, and this one surprises most people. Magnesium glycinate, taken before bed to 300 to 400 milligrams. This mineral directly relaxes the muscles surrounding the sciatic nerve. Tight muscles around the nerve are often worsened by magnesium deficiency, which affects up to 70% of adults. Within 2 to 3 weeks of consistent magnesium supplementation, many people report a dramatic reduction in nighttime nerve pain and muscle spasms. Combined with the 5 moves we just covered, this is your complete sciatic nerve protocol. Natural, proven, and 0 side effects. Here's what you can realistically expect. Day 1, you'll feel more movement and less stiffness. Day 2, the radiating pain down the leg begins to reduce. By day 3, most people sleeping better, walking more comfortably, and starting their morning without that dreaded pain spike. But here is the truth. These exercises must become a habit. Sciatica comes from lifestyle compression. You fix lifestyle compression with consistent daily movement, not a one-time fix. Do the morning reset every day. Do the Piriformis release 3 times daily. Do the nerve glide every morning and evening. Give it 7 days and then come back and tell me in the comments how you're feeling. I read every single one. If this video helped you or someone you love is suffering from sciatic pain, please share this video with them right now. It could change their life. Hit the like button, subscribe if you haven't already, and drop sciatica free in the comments below so I know you completed the full video. I'll see you in the next one. Take care of your body. It's the only one you have.